So let's get into diabetes. Let's get back to diabetes. So, a diagnostic test for the diagnosis of diabetes mellitus. Now we're talking about diabetes mellitus. Diabetes insipidus was when we spoke about the decreased production of the ADH, which was leading to a copious amount of diuresis, which is urinating, and a issue with the kidneys and not an issue with the pancreas, which is what diabetes mellitus is. So a diagnostic test for the diagnosis of diabetes mellitus includes a random glucose level greater than or equal to 200, a fasting glucose level greater than or equal to 126. A fasting glucose is before meals. A hemoglobin A1C level greater than 6.5. The hemoglobins are ranged within like the last 6 weeks or so. A glucose tolerance test revealing a postprandial glucose greater than or equal to 200 2 hours after 75 grams of glucose is administered. And the glucose tolerance test is after meals. Some confirmation of diabetes with hemoglobin if above 6.5. The normal range for hemoglobin should be 4 to 6. Hemoglobin A1C, to be exact, should be 4 to 6. Pre-diabetic is 6.5. Type 1 diabetes. This is when the beta cells do not produce insulin. It is autoimmune. Signs include extreme thirst, which is polydipsia, extreme urination, which is polyuria, extreme hunger, which is polyphagia, rapid weight loss, irritability, weakness, fatigue, nausea, vomiting, fruity smelling breath. They will always need exogenous insulin because there is no endogenous natural insulin being produced. For type 2 diabetes, this is when the cells are resistant to insulin. This is modifiable. Signs include possible polydipsia, polyuria, polyphagia, excessive weight gain, a family history of diabetes mellitus, poor healing from scratches, blurred vision, itching, drowsiness, increased fatigue, and tingling numbness in the feet. Tingling numbness in the feet. So those are the differences between type 1 and type 2 diabetes, which pretty much type 1 is type 1 is an autoimmune disorder where the beta cells are not producing any insulin. They're always going to need insulin because their body is not naturally producing any insulin. Type 1 diabetes could experience ketoacidosis if their insulin and their blood glucose are not properly controlled. Whereas type 2 diabetes is the one where it is modifiable, normally brought on by weight gain, family history of diabetes, a poor diet, excess sugar in the diet, excess sodium in the diet, but the insulin is not that the body is not producing any insulin or the insulin is not going into the cells, it's just that they are more resistant. And these people don't always need insulin. It is kind of like on an as-needed basis, but they might be more on an oral metformin or like a more oral glycemic control type of drug.